Well, David, it's fantastic to be with you today. And I know that you are the CEO and founder of Third Horizons Strategies. You also have founded HC3, and that is Healthcare Council of Chicago. So a big focus within healthcare within the city of Chicago. And then here you are now taking on this ELC, this Executive Leadership Council role within Community Health. So excited to be here with you and excited to dive into the conversation.
Well, thank you so much. I really appreciate the invitation to share some thoughts.
Chicago has a lot of challenges, specifically within the healthcare space and providing the care that residents need. I would love to hear you talk a little bit more about that, what captured you and why you have dedicated your career and a lot of your personal time to addressing those issues.
Yeah, well, thanks for the question. There's two things that come to mind for me. The first is it's probably just a little bit more academic in nature, but this is, and anybody watching this will obviously understand this, but if you begin to look at our country, Chicago and otherwise, we spend $4 trillion a year in pursuit of creating resources that promote people's health, their ability to live their best lives and be productive and to recover from illness and the like. So that's more per capita than any other OECD country, and yet our results obviously trail all OECD countries. And it's just it is mind-boggling to me how in a country like the United States you can spend $4 trillion and just suck so badly at delivering care, not just to the underserved, I mean, across the board, but the underserved get it the worst. And that's what really drives disparities. And we have this medical industrial complex in this country that is so ingrained because of financial incentives and power structures that it's hard to move it. And you think about those assets and resources, and that if we were doing it differently, real lives, real families, real intergenerational implications are affected. So that's kind of the first thing that I think, as an economist, I love things like that. I love problems like that. On the more personal side, for me, I'm on the one hand, I kind of won the human lottery, right? I was born as an American citizen, as a white male. In the 20th century, where the things I'm uniquely good at are worth some things economically. And if you break down the probability of that, it's like there's like 2% chance that I could have been born into those circumstances. And when we relocated to Chicago, it was kind of one of the first times in my life you could drive through a neighborhood, you could see, I could see, and there was a resonance of some of the things I had been through in my life, but you could see this on display in communities. But then, you layer in 4 centuries of indentured servitude, slavery, racism, whatever the case may be, and you look at just the sheer magnitude of economic divestiture in these communities, and it just pisses you off. I often think I've got a 10-year-old, an 8-year-old, and a 5-year-old children, and I often think about the life that they will have just by virtue of the way they entered the world versus the probability that their peer groups just a few miles away will end up. And the inequity there is palpable, and it's damning to our country. And so it's those two things I think have really been the catalyst for my zeal, my passion in these areas.
I read the book by David Ansel, Death Gap, a few years ago, and I think within that just outlines very well exactly what you so pointedly spoke to, and you saw and you still see and are experiencing, but yet trying to address and combat. And I know it's been a couple of years, David, since we've connected, but what I know about you is you always have multiple plates spinning at a time. Where's your focus?
So for the Healthcare Council of Chicago, we're continuing to hone the various activities or initiatives that we're focused on, all in service of addressing disparities. And in that, in those buckets, we do a lot on primary and secondary violence prevention. We've been doing a lot of work around housing, and other efforts. There's kind of a second thing that ties to that we've been working on, which is an initiative we call Southside Health. And we have about 20 different partners that have come together with an interest in building out a community health worker driven but concierge centered model of care, meaning instead of individuals in underserved communities having to wait till the last minute to do something because the health system is so hard to engage, we are constantly engaging them and we are pulling them in, but doing it in a way that is that honors, it's respectful, honors dignity, confidentiality, privacy, but creates a seamless experience in being able to access specialists or mental health providers. Like we talk about disparities and inequity like it's this big complex math problem that's going to take, like we have to sit down and plan it out and come up with a 10-year plan and iteratively move everybody in that direction. Like, no, that's bullshit. Because community health like literally is doing those things today. Other FQHCs are doing those things today. And I think there's a big onus on other organizations, big health systems, to emulate where they can those lessons. And if you had that done at scale in this city, we may not solve our long-term inequities problem. There's other stuff outside of health that encroaches on that. But God, would we make a big dent in people's lives? And there's nothing holding us back except us getting in our own way. My God, if a community health could be creating access to anyone that needs those services at no cost, and we have a $4 trillion medical industrial complex that can't seem to get out of its own way. We as a country, we can't go from 4 trillion to nothing. But their community health proves that we can be a hell of a lot more efficient with our resources and provide better access to care than we are. And how could you not just love not just the idea, but that the actual execution, which they have years and years of under their belt.
Yeah. So let's talk a little bit about All in Chicago.
Go participate, contribute, because there is the ability to connect with people doing really important work. Like they're all there. The topics that are discussed are not just done at the abstract level. There's a lot of depth and specificity to that. You'll walk away having been touched, you'll walk away having learned something, and you'll walk away having made a couple new friends. And there's really no other platform in the city where I can say all three of those boxes get checked every time like they do with All In.
Thank you so much for your time and for being so vulnerable and being open.
Of course. I'm too scared of what will happen to my soul if I ever said no to anything community health asks me for, because they do incredible work.